We did CALGB 50801, which is a U.S. intergroup study looking at patients with bulky classic Hodgkin lymphoma. And it was a PET-adapted study. So the questions that we were asking in our hypothesis was that we could omit radiotherapy in patients who were negative by PET scan after 2 cycles of ABVD. And for those who were PET positive, we escalated therapy and included radiation with hopes of improving outcomes in that particular subset of patients. And overall, we enrolled 94 evaluable patients, and of those, 78% were PET2 negative. The patients in the PET2 negative arm receive a total of 6 cycles of ABVD, and they had excellent outcomes with a progression-free survival of 93% at 3 years. The patients who were PET2 positive received 4 cycles of escalated BEACOPP followed by radiotherapy. And in that group, the outcome was unexpectedly good at about 90% at 3 years. Interestingly, the Alliance had done a prior similar study in non-bulky classic Hodgkin lymphoma, though patients received a total of 4 cycles of ABVD, and the PET positive received 2 cycles of escalated BEACOPP. The outcomes in that study in the PET2 positive patients was 67%. So we were quite pleased with the outcome. And really, I think there have been a number of studies that have recently demonstrated, including the RATHL and other PET-adapted studies, that for those who are PET2 negative early, that omitting radiotherapy does not appear to compromise progression-free survival, and we can avoid the late toxicities of radiotherapy, including cardiovascular disease and risk of second cancers, particularly in young women.